Millions of years ago, it is believed that this virus emerged from prehistoric humans interbreeding, which was passed down in the earliest humans when our lineage split. But what does this imply in our modern world? In the current world that we are living in, this virus still scatters, affecting people worldwide. According to the recent statistics, 3.7 billion people are affected by this kind of virus. Join us as we discover the depths of the Herpes Simplex virus type 1. HSV1 is responsible for establishing primarily and recurrent vesicular eruptions, primarily in the orolabial and genital mucosa. HSV1 is mainly spread by oral-to-oral contact or through contact with an infected spit or saliva.
Herpes simplex virus 1 or HSV1 typically causes oral herpes. The signs and symptoms may include cold sores or painful fluid-filled blisters or sores around the mouth, lips, gums, or throat. Next is fever. So occasionally, fever and general malaise can accompany the initial outbreak. And lastly is sore throat. In some cases, a sore throat might accompany the initial outbreak.
Herpes simplex is due to the herpes simplex virus, both type 1 and type 2. With person-to-person transmissions through direct and indirect contact with an infected person's secretion, particularly on the mouth and genitals, such as kissing, drinking from the same glass, sharing the same lipstick, or having sex without wearing a condom. A viral culture is done to diagnose oral herpes. It is made through swabbing a sample of fluid from a sore in the mouth. Another test to be done to diagnose oral herpes is a blood test that looks for HSV antibodies in the blood sample. HSV antibodies are proteins that your immune system makes to fight the said virus. Treatments for recurrent episodes is most effective when started within 48 hours of when symptoms begin. Antiviral medicines commonly given include acyclovir, famciclovir, and valacyclovir. Taking a lower daily dose of one of these medicines can also decrease how often symptoms occur. People with symptoms of oral herpes should avoid oral contact with others, including oral sex and sharing objects that saliva can touch. Individuals with symptoms of genital herpes should abstain from sexual activity while experiencing symptoms. For sexually active people, consistent and correct use of condoms is the best way to prevent genital herpes and other STIs. Condoms reduce the risk. However, HSV infection can still occur through contact with genital or anal areas not covered by the condom.